My name is Isabella Garcia, and these are my parents, Tanya Garcia and Fernanda Garcia. The topic I chose was euthanasia in America. Euthanasia is a very controversial topic in the US. I'm not here to persuade, I'm just here to inform. So, by the book definition, Merriam-Webster Dictionary states that euthanasia is the act or practice of killing or permitting the death of a hopelessly sick or injured individual in a relatively painless way for reasons of mercy. So, for the sake of this speech and for further clarification, euthanasia is done only with the express consent of the patient. Also, euthanasia is known as physician-assisted suicide. So, euthanasia is usually done with a terminally ill patient that has a degenerative disease. This disease causes large amounts of pain while somebody is alive. For example, Lou Gehrig's disease, which is a neurologic degenerative disease that causes neurons to degenerate in the spinal cord. Now, there are two main types of euthanasia. There is the induction drug, which contains a barbiturate, which is a central nervous system suppression drug, a potassium, and a paralytic. This type of euthanasia is only done on death row inmates. This is because it's considered an active type of suicide rather than a passive type of suicide. The other type is an oral drug. This is usually done in a pill or liquid format. Now, the liquid format is usually taken with a juice or a milk, like chocolate milk. This is usually done in a hospital or clinical type setting with supervision. However, the pill can be taken at home with supervision. Now, euthanasia already does exist in certain states in the US. So the federal government and the state's government do have a difference in opinions about euthanasia. According to the death with dignity laws by state, the federal law does not specifically protect the act of mercy killing or euthanasia, nor does it prohibit the practice altogether. So in total, there are 11 states that have legislation for euthanasia. These states are California, Colorado, Hawaii, Maine, Montana, New Mexico, New Jersey, Oregon, Vermont, Washington, and Delaware. However, Washington, D.C. also does have legislation for euthanasia. Delaware is the most recent state to have euthanasia put into legislation, specifically on May 20th of 2025. According to the Delaware legislature, this act permits a terminally ill individual who is an adult resident to request and self-administer medication to an individual's life in a humane and dignified manner. Now, there is a difference in opinions in the medical community when it comes to euthanasia. So generally, with the Hippocratic Oath, euthanasia is considered improper and amoral, regardless of the consent or want of the patient. This is because it falls under the it does more harm than good clause. According to the American Medical Association specifically, euthanasia is fundamentally incompatible with the physician's role as a healer. So to give a brief summary, euthanasia, also known as physician-assisted suicide, is both legally and ethically controversial in the US. So even consensually, many don't agree because the loss of life it causes to the patient. However, as years pass, more and more states start to support it, like Delaware in 2025. The pattern seems to want to continue. However, the reason why it may not is if the federal government does get involved. Now, thank you for listening to my speech and watching this video.